the whole picture.
Hello, I'm Esther Gitu. Welcome to Africa 54. Here's what's coming up.
Israeli military forces push deeper into southern Gaza, hunting for Hamas militants as international aid organizations express concern that civilians do not have a safe escape from the war. Delegates at the COP28 summit in Dubai address the impact of climate change on public health amid warnings that global warming could increase the risk of deadly diseases. And a 70-year-old Ugandan woman gives birth to twins after receiving fertility treatment, making her one of the world's oldest new mothers. All this and much more coming up on today's Africa 54.
The Israel Defense Forces rolled deeper south into Gaza as it called for more evacuations in the southern portion of the enclave in its pursuit to eradicate the Hamas leadership rulers. The war has already killed nearly 16,000 Palestinians, according to the Hamas-run health ministry in Gaza, and displaced over 75% of Gaza's 2.3 million residents. International aid organizations are expressing concern that civilians do not have a safe escape from the conflict. Israel tanks and troops moved near Khan Yunis, a southern city that is the second largest in the Gaza Strip, while Israeli aerial attacks and bombardments in southern Gaza continued. Warnings from the Israeli military in recent days urged people in multiple Khan Yunis neighborhoods to evacuate for their safety, directing them to areas further south. Lynn Hastings, humanitarian coordinator for the occupied Palestinian territory, says nowhere is safe in Gaza and there's nowhere left to go. The Hamas-run Gaza Health Ministry says at least 43 people were killed in Israeli airstrikes on Khan Yunis Tuesday, the 58th day of Israel's war on Gaza. Dozens of injured were treated on the floor of the overwhelmed Nasser hospital in Khan Yunis. Some of the wounded rushed to the hospital were children from an Israeli strike on a school in Khan Yunis.
As you can see here, there are a lot of people crowded together. People light fires to cook. The bombardment is affecting the environment. The smoke and fire affects the environment. Overcrowding also affects the environment and spreads diseases. Look at the environment around you. All of this is not habitable. All of this will affect the environment, the people, the society as a whole. And this crisis will most probably spread outside.
They told us to leave Gaza. There is a war in Gaza. So we left the north and came here to the south, just like they asked. But this is what we have found in the south. What can we do? This is my son. He was born on the second day of the war, and we haven't been able to register his birth yet at the civil registry.
Israel accuses Hamas of putting civilians in danger by operating from civilian areas, including in tunnels which can only be destroyed by large bombs. Hamas denies it does so.
On September 16, 1982, members of a Lebanese Christian militia known as the Phalange, led by Elio Beika, in coordination with the Israeli army, stormed the Sabra and Shatila Palestinian refugee camps in South Beirut, killing between 800 and 3,500 Palestinian refugees and Lebanese civilians in 2 days. Mahmoud Surur remembers the piles of the bloated corpses. He lost 7 members of his family in what was one of the most brutal massacres of the Lebanese civil war.
When I entered the house, I saw that they killed my mother, my father, and 5 of my brothers and sisters. Some of my neighbors were beheaded. Other bodies had been tied up and raped.
A small museum inside Shatila camp also preserves memories of the Palestinian refugees' decades of trauma and forced displacement.
This reflects the lifestyle of the Palestinians before 1948
If you don't have the past, you will not have the future. They want us to be slaves, but we will not be slaves. We are fighting for our right.
More than 4 decades after the massacre, Palestinians at the camp say life is still unbearable. Now, the war in Gaza and the clashes along the Lebanon-Israel border raise fears of a wider conflict. Jamila Shehadeh directs the Shatila Center of Beit Atfal Sumud, an NGO that addresses the needs of Palestinian refugees in Lebanon.
What we are witnessing in Gaza brings to mind the Sabra Shatila massacre, and perhaps it will soon be our turn to suffer the same fate. That is why we are scared. War means destruction.
People here say images of the war in Gaza are driving them to unconditionally support Hamas militants.
Hamas is a true Palestinian resistance movement. It is carrying out what every Palestinian would like to do. If Israel attacks Lebanon, every Palestinian must be part of the resistance, and I am one of them.
The Hamas-backed Gaza Health Ministry says more than 14,000 people have been killed there since Israel launched the war against the U.S.-designated terror group in response to coordinated attacks on October 7th. On that day, Hamas gunmen killed 1,200 people, mostly civilians, and kidnapped more than 200 people, including children. Israel says it has been preparing to open a second front in its war on militants if Hezbollah steps up its attacks from southern Lebanon. Lebanon is already on the verge of collapse after years of the economic chaos. The rising anger and tension among Palestinians in the country and the prospect of a new all-out war is for many Lebanese cause of concern. Nicole D'Ilio, VOA News, Beirut.
That report was filed by Nicole D'Ilio from Shatila refugee camp in Beirut, Lebanon. Linda Thomas-Greenfield, the U.S. representative to the United Nations, travels to Ghana and Namibia beginning on Tuesday. In Ghana, Ambassador Thomas-Greenfield will lead the U.S. delegation to the 2023 UN Peacekeeping Ministers meeting. She is to announce U.S. pledges to improve the effectiveness of UN peacekeeping operations. In Namibia, Thomas-Greenfield will deliver the keynote address to at the dedication ceremony of the new U.S. Embassy compound in Windhoek. For the first time, delegates meeting at the COP28 summit in Dubai have addressed the impact of climate change on public health amid warnings that global warming could increase the risk of deadly diseases. Henry Ridgewell explains.
Pakistan suffered the worst flood in its history last year, which scientists say was likely exacerbated by climate change. Thousands were killed and homes and livelihoods destroyed. The floodwaters also provided a vast breeding ground for mosquitoes, leading to a 400% increase in cases of malaria countrywide, the worst outbreak since 1973. Scientists say this is just one example of how climate change is having a big impact on human health. For the first time, the UN Climate Change Conference is addressing that impact at its annual meeting this year in Dubai, United Arab Emirates.
Although the climate crisis is a health crisis, it's well overdue. That's 27 COPs have been and gone without a serious discussion of health. Undoubtedly, health stands as the most compelling reason for taking climate action.
Diseases like river blindness and sleeping sickness are spread through parasitic worms and flies, organisms that could proliferate in a warming world. Air pollution from fossil fuel burning kills an estimated 7 million people globally every year.
Climate crisis is a health crisis. It affects you with air pollution, of course. That's what people might think of right away. So your lungs, but also your cardiovascular system, so that's your vessels, your heart. But it will also affect with the rise of infectious disease, more antimicrobial resistance, and of course all the refugees, climate refugees that are going to be in insalubre condition, food security.
Former US Secretary of State Hillary Clinton told COP28 delegates that women's health is disproportionately affected by climate change.
They're in fields, they're in factories, they're in markets, they're doing all kinds of work that becomes absolutely impossible if temperatures get to 40, 50 degrees centigrade.
COP28 host, the United Arab Emirates, along with several charities, pledged $777 million Sunday to help fight neglected tropical diseases that could be worsened by climate change. More than 120 countries at COP28 signed a declaration acknowledging responsibility to safeguard human health in a warming world. But critics say it made no mention of cutting fossil fuels, the main source of greenhouse gas emissions that are driving climate change. Henry Ridgewell, VOA News, London.
And it's time for our health report. And joining us now is Africa 54 health correspondent Lino Mudu. Hello, Lino.
Hello, Esther. Well, a 70-year-old Ugandan woman has given birth to twins after receiving fertility treatment, making her one of the world's oldest new mothers. Safina Namukwaya gave birth to a boy and a girl last Wednesday via cesarean section at a medical center in Kampala. The Women's Hospital International and Fertility Center is also where Namukwaya received in vitro fertilization treatment. She's not the oldest mom, as a 73-year-old woman in southern India gave birth to twin girls following IVF treatment in 2019. But she is the oldest woman to deliver a baby at the hospital, whose founder is a prominent gynecologist in the East African region.
What inspired me to give birth at my advanced age is that I had failed to conceive during my younger years, and I had no children of my own until I grew old. All the children I kept raising over the years, I had none, and when they grew up, they left me alone. That is why I decided to look for my own children. This pregnancy with the twins took a toll on me. I didn't have energy, and I could not work or do anything. Even the work I used to do, I could no longer do by myself, and I had no one to help me.
We as the hospital, we also believe that age is just a number, but we have to go ahead and do the assessment. We started by doing the basic things. Number one, assessing her pressure. We have been monitoring her pressure all through, and it has been a normal pressure. Number two, we looked at also her sugar levels. Her sugar levels have been relatively normal. We went ahead and assessed other organs, the liver, the kidneys, and all, and we noticed she was okay. She didn't have any issues maybe with the back, so we noticed that she's able to carry the pregnancy.
The Population Council has announced that the dapivirine ring has now received regulatory approval or authorization for use in 11 countries in East and Southern Africa. Made of flexible silicone, the ring slowly releases the antiretroviral drug dapivirine in the woman's private part over a 1-month period. The ring was developed to provide a long-acting prevention method for women when higher efficacy products like daily oral PrEP are not viable options.
The dapivirine ring is a vaginal ring made of a flexible silicone. It's inserted into a woman's vagina for 1 month at a time, and it slowly releases an antiretroviral drug called dapivirine at the site of potential infection. So dapivirine works by preventing the virus from being able to replicate itself or make copies of itself inside of a healthy cell. Therefore, by women using it, they can reduce their risk of acquiring HIV from sexual infection. The ring is discreet, so women can use it, they can insert it themselves, and it can be left there for a month at a time. So there's no remembering to have to take pills on a daily basis, and there's no need to go in and get an injection every couple of months from your doctor. It's something that women can control themselves, and it gives them empowerment over their sexual health. Young women and adolescent girls in Africa are 3 times more likely to acquire HIV than young men and adolescent boys in sub-Saharan Africa. We see the ring as a critical tool needed to be able to expand HIV prevention options for women. We want to empower women with choice, and we hope that this will help to have a real impact on the HIV epidemic. Right now, the ring is being made available to government bodies and to procurement bodies to purchase at a price of about US dollars 12 to 15 or so dollars, depending on the country. We think that moving the manufacturing locally into Africa will allow that price to be cut significantly, potentially more options to be able to reduce the price based on another product we have in our portfolio, which is a longer acting dapivirine ring that women can use for 3 months, therefore really bringing down the annual cost of using the product.
That's our health report for today. To stay in touch, find me on X at Linor Moudou. Back to you, Esther.
Thank you so much, Lino. Be sure to watch Lino Moudou's health reports every Tuesday right here on Africa 54. And still to come, learning how artificial intelligence may transform industries, reshape our jobs, and boost economic productivity. We'll be right back.
This week on Straight Talk Africa. The UN's annual campaign, 16 Days of Activism Against Gender-Based Violence, is underway. Its goal is to prevent and eliminate violence against women. Join me, Heidi Adams, and my guests as we discuss whether activism has been effective in protecting women and girls in some African countries. On the next Straight Talk Africa.
Health, wellness, sport, beauty, medical breakthroughs. Healthy Living cares about your well-being. What are the main health concerns in Africa and around the world? Find out the latest on coronavirus. Connect with our experts and ask them questions.
How long does the virus stay?
Join me, Linor Moudou, in Washington, every week on Healthy Living, right here on VOA.
In other news, Britain's Interior Minister James Cleverly arrived in Rwanda on Tuesday to sign a new treaty in an attempt to overcome a Supreme Court decision to block the government's controversial policy of sending asylum seekers to the East African country. A Kenyan court is suspending the privatization of nearly a dozen state companies after the country's main opposition party filed a case against the government's plan to raise revenue. Kenya's cash-strapped government revised the privatization law this year, making it easier to sell off state companies. And Nigerian President Bola Tinubu is ordering an investigation into a weekend military drone attack that killed at least 85 people, including women and children in northern Kaduna. Nigeria's military is in a war against Islamist insurgents in the northeast. Kenya has the 7th highest number of people living with HIV on the continent at 1.4 million, according to the National Endemic Disease Control Council. The country has, however, made progress in slowing its spread. Juma Majanga reports from Nairobi.
Lucy Wanjiko was a teenage mother right out of high school when she tested positive for HIV. Her child died 2 weeks later.
So in my first book,
Wanjiko, who lives in Nairobi, drew upon her own experience years later to found Positive Young Women Voices, a community-based organization that advocates for and supports girls and young women affected by HIV.
There's a girl somewhere, the same way I felt I had no one to hold my hand, probably needs me now to come in and hold her hand. Probably listening to my story, she'll make better choices than the ones I did, and she won't have to go through what I had gone through.
The government is also combating the disease. Dr. Lynette Juma, an infectious disease specialist in Nairobi, says training healthcare professionals in HIV management, increasing health facilities in various parts of the country, and providing free medication are some of the factors that have contributed to improvement of HIV care in Kenya.
There's reduction in mortality, there's reduction in morbidity. So we are not in the era where you see someone who looks skinny, emaciated, and you're like, oh, that is HIV/AIDS. I mean, people are living healthy and able to mingle with everyone else without their status being known.
Of the 1.4 million people living with HIV in Kenya, 1.1 million are enrolled on antiretroviral therapy, with 73% of them achieving viral suppression, according to the country's Ministry of Health data. Over the past decade, new HIV infections have decreased by 78% and AIDS-related deaths by 68%, the National Syndemic Disease Control Council reported. Despite the milestones, health experts say the prevention of mother-to-child transmission remains a challenge. Wanjiko says testing has changed over the years.
I tested when I was 2 months pregnant. I never got tested again. But now there's testing, I think, for every visit you go to the clinic as a pregnant woman or mother, you have to get tested.
World AIDS Day is observed each year on December 1st, and this year's theme is Let Communities Lead. Juma says communities play a fundamental role in eradication of HIV in Africa.
There's a lot of measures that can be put in place when you know your status, be informed. And that way, I think Africa will be able to eradicate the HIV infection.
Despite all the good work, AIDS is still considered an epidemic in Kenya. But the country is working with the United Nations to ensure new HIV infections and AIDS-related deaths drop by 90% between 2010 and 2030. Juma Majanga, VOA News, Nairobi, Kenya.
Mali is experiencing a severe electricity crisis that analysts say will have dire economic consequences. For the first time, citizens are openly criticizing Mali's military government, which has until now enjoyed widespread support in the capital. Annie Reisenberg has more from the capital, Bamako.
Mohamed Kante has been a carpenter since he was 20 years old. In recent months, his workshop, normally buzzing with the sound of his many tools, sits largely silent because of what he says are the worst power cuts Mali has experienced in recent memory. Generators are unaffordable for most of the Malian population, even for skilled workers like Kante.
If the electricity is cut, all of my work stops. Even today, since the morning, there's been no electricity. It just came on at 2 p.m. And we have a lot of furniture that we're supposed to deliver today.
Modibo Mao Makalu, a Malian economist and former economic advisor to the presidency, says the consequences of the electricity cuts are substantial. He says this is especially so in a country like Mali, where 98% of businesses, like Kante's workshop, are part of the informal sector.
Depending on the frequency of the cuts, we can assess the damage caused by the cuts at between 2% and 5% loss of points of gross domestic product.
The government pledged the situation would improve. The government has not said what it is doing to address the situation. For Amadi Diko, the issue goes further than just electricity supply. He considers access to electricity and other basic services a barometer of social justice. Diko was part of the M5 opposition movement, which organized massive protests before an August 2020 coup. While M5 members didn't take power in any way at the time, the protests created the conditions for the coup. Discontent with the government spread widely after protesters were shot and killed in the weeks preceding the coup. Diko says he remains active in calling for good governance regardless of who is in power.
When we entrust power to someone, we have to hold them accountable. We must monitor the commitments they have made to the population. This is our role as leaders in civil society.
Diko and other fellow activists organized a march calling for the resolution of the electricity crisis. The protest was supposed to take place last Friday. Citing security concerns, the military government denied the group the right to march. The march's head organizer was arrested Friday and remains in custody. The group has also demanded that the government organize timely elections. Last year, the government announced that elections would take place in February 2024, but in September said the vote would be canceled for what it called technical reasons. Annie Reisenberg, VOA News, Bamako, Mali.
Artificial intelligence may be one of history's most significant technological leaps. It is poised to unlock new business models, transform industries, reshape our jobs, and boost economic productivity. For more insight, VOA's Paul Ndiho is standing by live at the Government of Artificial Intelligence Conference ongoing here in Washington, D.C. Hello, Paul. Tell us what this AI conference is all about.
Thank you, Esther. We are here at an AI conference that brings together government agencies, stakeholders from the AI and tech industry. They are all here to figure out a way to how to incorporate AI in their workforce, how to bring about this technology that we are talking about. What is it can be done to make sure that some of this technology is incorporated into the government sector. So those are some of the conversations taking place. Earlier on, there was a guest speaker from OpenAI who said that this is perhaps one of the biggest leaps in technology that has happened since the invention of the internet.
Most people wonder whether there are any risks associated with artificial intelligence. What do you know?
Absolutely. As much as a lot of people here are using AI for good, there is going to be a lot of risks associated with it. There are some bad actors who are already using AI to do bad things. But overall, most of the people that I've talked to, people that we've spoken to today, think that if AI is used very well, it could actually change a lot of things. It could help us figure out how to address issues in healthcare, issues in agriculture, renewable energy. So even government, the way government works with people, government works with a lot of contractors, agencies. If they incorporate AI into some of their business practices, this could help them be efficient, be productive at what they do. So there are good reasons to use AI, and at the same time there are risks associated with that. But how to mitigate those risks is what is important, and that's what we are trying to learn today.
Paul, very quickly, should people worry that AI will render them jobless?
That's the biggest million-dollar question that everybody is asking. Yes, there is potential for AI to take away some jobs, but this is in the future. It's not in the immediate. For example, almost every single person, every speaker who has spoken about this subject, they talk about that. They say, yes, AI has the potential to displace a lot of people, but it's going to be a while before that happens. So for now, you don't have to worry about your job. I think our jobs are secure.
Well, AI, Esther, AI, Paul. All right, Paul, thank you very much. VOA's Paul Ndiho reporting live for us at the Government Artificial Intelligence Conference here in Washington. And that's our show for today. Be sure to watch Africa 54 on our website at voaafrica.com. And from all of us here in Washington, thanks for watching.